I still remember that day I was working in one eye clinic. At that time, I didn't become an eye doctor, but I was working together with senior doctors there. So that morning, I was taking patient eyes using a machine you could know called an autograph machine. And I suddenly saw one of my friends who I haven't seen for decades in the patient's queue, together with an elderly man. He was sitting next to him. The first time I saw him, I instantly recognized him. So at that time, I felt very much happy, because I would be the one to take my friend's eye. You know that kind of feeling when you become something and you want help and all the friend. So when it was his turn to get his eyes checked, I collected his file. But then something terrifying happened. I just noticed that the file he was holding was a green file. And that means one thing in our clinic. That is a glaucoma patient. So I was like confused and like not sure. I have to double check it. This is file or is for the person sitting next to him. And I checked, I collected the file, checked it, and I found that exactly is his file. I looked at the elderly man sitting next to him, and he was also holding a green file. I collected it, checked it, and it was also his file. He is also a glaucoma patient. So I looked at their names, and from their names I learned that this is his father. And even though I confirmed that he was his father, I have to like further ask him, is this your file? He said, yes, it's my file. And you have glaucoma? He said, yes, I have glaucoma. And to be honest with you, at that time, he didn't recognize me. So I instantly felt very sad, cold, and discouraged. So much that I felt to reveal myself to him because there was nothing I could do. From his file, from the way I see, he lost most of his vision and he could barely see now. And if you lost your vision due to glaucoma, there is nothing doctors could do about it to reverse the vision loss. You all know it. There is no known cure for glaucoma yet. Anyway, I composed myself, checked his eyes, and let them go. And from that time, I sat down thinking about it. I felt very sad about it, and I was thinking about what exactly is the cause of this. And I noticed that it was lack of awareness. My friend didn't know about the danger of glaucoma. He didn't know that if any one of your relatives, like your father, your mother, your siblings, or anyone closely related to you has glaucoma, you are most likely to also have glaucoma. And that is even if you are not old. He didn't know that. That's why he didn't get his eyes checked earlier. And that is what resulted in that. And from there, I promised myself to start raising awareness, not only about glaucoma, but about eye health or eye diseases in general. And from there, I became more serious about making videos raising awareness about glaucoma and also about eye diseases on TikTok and Instagram and also here on YouTube. So what I also learned is that most people, including myself at that time, thought that glaucoma could only affect elderly people. I mean like people from 40 years and above. Even though at that time I was taught in class that glaucoma could affect anyone at any given time because even babies are born with glaucoma and call that congenital glaucoma. But to see it reality, that is something different. So when I saw it in real life, I further confirmed it that it can affect anyone at any given time, especially if you have a family history of glaucoma. What I also notice is that most people think they will know when glaucoma started in their eyes. They expect to feel like pain, blurry vision, headache, or see redness, or any kind of changes with their eyes. That is true for other eye diseases, but in case of glaucoma, that is different. Glaucoma is a silent disease. You cannot tell by the way you feel or see whether or not it started affecting your eyes. You can see perfectly, you will feel nothing, but deeply inside it started affecting your eyes. And unfortunately, by the time people started noticing, the damage is already there. Just recently, a friend of mine called me and he was complaining to me that his uncle could now barely see. He has lost most of his vision. And they went to the clinic and they told them that it was glaucoma. So he called me, it's like because I'm a friend to him. So it's like you have a friend who is a doctor. So he called me if there is anything I could do, or if there is any other, if there is anything I could do, like medications or surgery. But when I explained to him what glaucoma is all about, he was shocked. He said he didn't know that is how the disease is. And he later told me that he noticed it, and he noticed that some years back his uncle has some problems because they are working together in a market, and he noticed that he don't see clearly when something is by his sides. That is what he said. And sometimes even in front of him. For example, a person will be in front of him, but he would not be able to recognize who is he. Most people have advised him to get his eyes checked, but he refused, believing that he can still see. And that is exactly the danger of glaucoma. And unfortunately, by the time they visited an eye clinic, the damage was already done. And there is nothing they could do about it, but rather give them medication. So he told me they gave them medications called Misopt, and he has been using it for years. And he has been using it, but there is no any kind of improvement. And that is true for glaucoma. When you go to an eye clinic, they will only give you the medication that will stop it from progressing, but not to cure the disease. That is exactly what is happening.